I'm Dr. Jonathan Sackier. I'm a surgeon, an aviator, and I've had a wonderful career working in innovations. Today, I'm talking to Dov Baron about three things: how CNN, Fox, and the news cycle affect your nervous system and health. We're going to ask whether your employees feel enough trust in you to treat you like their surgeon. And I'm going to tell you about advancements in non-invasive medical technologies to help you be more mindful, a better leader, and to keep those tigers at bay. Stay tuned.
Congratulations! You are tuned into Dov Baron's Leadership and Loyalty Show, the #1 podcast for Fortune 500 executives and those who are dedicated to creating a quantum leap in leadership. Your host, Dov Baron, he's an executive mentor to leaders like you, a contributing writer for Entrepreneur Magazine, CEO World, and he's been featured on CNN, Fox, CBS, and many other notable sites. Dov Baron is an international business speaker who was named by Inc. magazine as one of the top 100 leadership speakers to hire. Now, over to Dov Baron.
Welcome, dear friends, fans, and fellow aficionados of leadership excellence. Thank you for joining us on this episode of Leadership and Loyalty Tips for Executives. Most of us in the workforce today, particularly those in leadership roles, have come to our positions through some form of specialization. However, I put it to you that almost every innovation and advancement in science, in leadership, or for that matter, anything else, has been done through the convergence of multiple areas of expertise. Most often, that comes about by building exceptional teams. Sometimes it comes from individuals who are polymaths, in that they study different areas and find ways to bridge that knowledge into sincere innovation. One of those areas where that's becoming evident is in medical science. For example, we recently had on Dr. Skip Rizzo on the show. He has merged virtual reality technology with PTSD therapeutic development. Fantastic work. And if you haven't got that show, I encourage you to go back and listen. It's fabulous. Now, considering that, where do we take this polymathic view in the context of leadership and medical innovation to be more inventive, more successful, and while upscaling the quality of life for everybody? Well, stay tuned, because that's where we're going on our next two episodes. These next two episodes are brought to you in part by the Society of Brain Mapping and Therapeutics. The Society of Brain Mapping and Therapeutics catalyzes interactions between clinical, biological, and physical engineering sciences, examining emerging disciplines such as nanotechnology, image-guided therapy, stem cell therapy, biomaterials, and tissue engineering for rehabilitation from neurological disease. If you want to know more, simply go to worldbrainmapping.org. That's worldbrainmapping.org. As always, we need your help in staying relevant, so please do us a favor. And wherever it is that you tune into us from, get over there and rate, review, and subscribe to the show. It really does help, and we do appreciate it. And if you are a regular listener, big thank you to you for making us the #1 podcast globally for Fortune 500 listeners. And we are also incredibly grateful and honored to be cited by Inc.com as the #1 podcast to make you a better leader. By the way, I know you're curious. I'm Dov Baron. I'm your host, and I'm here to assist you tapping into the one thing in your business that changes everything by transforming meaning into action. Curious to know more? Simply go to dovbaron.com. That's DOVBARON.com. All right, let's strip it down and dive right in. Our guest for the next two episodes is Dr. Jonathan Sackier. He is an experienced executive leader, physician, entrepreneur, and innovator. With dual citizen in the United States and the UK, and he's worked between both of those places. He's trained in Britain as both a pilot and a surgeon. He helped pioneer laparoscopic surgery revolution. He's been a founding partner for several successful startups in the medical technology industry, recognized as an industry leader bringing innovative products from bench to bedside, such as AESOP, the world's first operating room robot computer. That's pretty amazing, right? He's earned 2 honorary professorships. One of them was from Oxford University. they don't give those out too easily. And another one from a research group in the Republic of China, People's Republic of China. He has experienced and launched and facilitated business growth in the GCC, Australasia, India, Russia, Europe. He's an esteemed member of the Global Chief Medical and Health Officers Network. He has a reputation for leading with the voice of the patient. He served as medical counsel to the Aircraft Owners and Pilots Association. On top of all that, he speaks internationally and hosts the EMJ-Health podcast. Ladies and gentlemen, please put your hands together for innovator, aviator, entrepreneur, leader, and Tottenham Hotspur fanboy, Sackier.
That is ridiculous. I have to tell you. I tell you, Dove, what I would actually like to do right now on camera, right now, is die. I think if I could just drop dead right now with those words ringing in my ears, no one's ever said as many lovely, lovely things. Thank you, my friend.
Do you know who Dame Stephanie Shirley is? She's a British, obviously she's a British dame, and she's very British, and she's in her 80s, and she was also dying of embarrassment when I interviewed her because like we've got such a stick up her ass as Brit. I said to her, "Don't worry, I got over it." But it's like, don't say too many nice things about me. I don't know where to go with that.
By the way, I have to interrupt you briefly because you mentioned Dame. Some listeners of your amazing show, Dove, in the United States may not know that she's a dame, not in the American sense of the word.
Yeah,
I once introduced some American colleagues to, I shan't mention his name, but he was an earl.
Right.
And I was explaining to them, he's an earl, he's not Earl.
Right, that's not his name.
It's not his name. Yeah.
Yeah, it's a cultural jump.
Truly.
One of the questions I like to start with, Jonathan, is in the context of leadership development. You're a very bright man. You and I have been friends for many years now. You've done some amazing things in the world, and you and I have had many conversations about many different areas of life. In the context of leadership development, what is the most frustrating thing to you that seems glaringly obvious, that seems to be ignored or dismissed by others? When you look at it from where you are, what you've learned about your background, what do you think we really need to focus in on in leadership development?
Well, first of all, big shout out to you, because for those folks who are listening or watching who don't know this, in addition to his amazing publishing and presentation skills, Dove is, without doubt, you are the most insightful human being I've ever met. And you helped me through some very difficult times in my life. And the insights that you taught me about me, teaching me, and what's your term? You can't be objective about your subjective reality. When you said it, it sounded amazing. I feel like a Burke saying it, basically. By the way, I don't normally wear Hawaiian shirts on businessy type things, but it is like 86 degrees in London today, and I don't have air conditioning, so I apologize. What have I learned about that seems glaringly obvious? I think
in the context of leadership development, the leaders need to know.
Yeah. When you described me in your very, very kind and generous introduction as a leader, I don't think of myself as such. Mm-hmm. And I think that's the fundamental problem. In the world of startups, when I talk to young physicians or not so young physicians or other folks working in a startup environment, and I say, what role do you want to play? And they say, well, I'm the CEO. And I said, really? Is that really what you want to do? Because I learned from a friend of mine who I introduced you to, Spencer. He pointed out to me that when people start a business, it's either because there's something passionate about or something they know about, preferably both. Running a business has got nothing to do with either of those things. It's facilities management, it's HR, it's raising money, it's contracts, it's telephone systems. And I think there's a misconception about what leadership is. To me, leadership is about being inspirational to others, aspirational for yourself, kind, polite, respectful, but most of all, setting the culture. Setting the culture for what environment you want to live your life in. And again, Dove, kudos, my friend, because you helped me understand this. And one of the tasks that you set me was to define my own boundaries. And I wrote down my boundaries for my business life, which I can share with you if you want. And those boundaries, I was very good with my business life, not so good with my personal life. That took me some more work, which again, you helped with. But having boundaries for what you will and will not accept, and working out when those boundaries are breached, what you're going to do about it. So my first boundary is, it's shamelessly stolen from an author named Sutton, who wrote a book called The No Asshole Rule. I would pronounce it the No Arsehole Rule. He was a business consultant and lecturer, I think at one of the West Coast universities. It's a brilliant book, and it's a very simple point. Having people in your organization who are assholes is hugely destructive.
Yes.
But understanding that if you're surrounded by such people, or you find yourself surrounded, what do you do? Well, my decision is very simple. I walk away.
Right.
Fighting fights, dealing with lawyers, I'm done with all that. So,
but you make some great points here, and I think it's important for everybody to stop and just take this in. And that is, first of all, is you may be in a, quote, leadership position, but I've dealt with this a lot in the past, where I've said to people, did you start your business so you could have a business card that said CEO? Because if you started your business, because everybody has an ego, let's not pretend we don't. We all have egos. And sometimes that ego will run away take the train off the track. And if you had that in order so that you could say, I am a CEO, you're already dead in the water, right? You might as well just go to the shop and get some business cards printed, and it doesn't really matter. And the considerations of what it takes much more. And some of those are, as you said, are very logistical and they're kind of boring. And then there is the other side of it, which is the aspirational, inspirational, as you put forward. And oftentimes those are not the two same people. Sometimes they are, but often they're not. And if you want to inspire others and you aspire to things in yourself, it's really important to know that you're not the kind of person who gets shit done at the nitty-gritty level. You may get big things done, but not little things done. And so, having that great team around you is so vitally important. And as you said, setting the culture for that team is vitally important. That can't be done without self-knowledge. And this part of that self-knowledge is, as you very well pointed out, is knowing what your own boundaries are. Because if you don't set them, somebody else will just continue to break them. Not because they are a-holes, although they might be that, but actually because...
You're allowed to say arseholes, by the way. I know. A colorectal background, you can say that.
Okay. You have a rectal background? Don't we all? If we don't, we're definitely in trouble. We're literally full of shit. So, we have to own that fully and take on what needs to be done. Let's just talk about innovation, because there is this section of leadership that is innovation, and that is, that's absolutely in your field of expertise, because you've taken medical technology, you've got aviation, you've got these backgrounds and many other things that people don't need to know about right now. But you've taken these things, as you know, I'm a polymath, and I love people who approach things from a polymathic response, meaning they take different things and put them together, and they make connections that are what really drives medical innovation, and how do we encourage it, particularly if we have a medical company?
Great question. So, by the way, I was told in an interview, you should never say great question. Of course, it's a great question. They're a professional interviewer. I like referring to people who've taught me things and calling them out. So one of them was a chap named Bill Cook, who passed a number of years ago. Cook built a family-owned medical device company in Bloomington, Indiana. And I had the great privilege to work with Bill and his right-hand man, a chap named Ken Hawkins, who was one of the most humble, understated, and natural leaders I've ever met. I can still consider him a dear friend. And Bill had a very simple mandate for the business that he built into a multi-billion-dollar company that employed people whose retention rates within the company were way beyond industry norms. His premise, and I've shamelessly adopted it as my own, is put the patient at the center of everything. Because if you put, why are we in healthcare? I would like to think it's because we care. And you said people who go into a business so they can have CEO on their card are doing the wrong thing. I think people who go into medicine so that they can, handle drugs and hold the power of life and death over people or make a lot of money, go get another job, for goodness sake, because you probably make a lot more money and you can be more of a bully than you ever can in medicine, which is much more of a team sport nowadays. But if you think about the patient experience, and if I consider myself one of the most privileged people on the planet, that having had complete strangers, I'll make a joke out of it, first of all, a complete stranger comes into my office and trusts me sufficiently to take all their clothes off. And a short while thereafter, they agree to lie on a metal table whilst paralyzed, surrounded by people they don't know wearing masks, and they've got knives. What's wrong with this picture, right? People have to trust you. And that is such a huge privilege that I took very, very seriously, profoundly seriously. So when these people came into my care, every aspect of my interaction with them, from the moment they came through the office door to the moment they were on my operating theater table and thereafter, I'm thinking about how can I do what I do better? Now, some of it is my attitude, some of it is my behavior, some of it is where the chair is placed in the room that I'm talking to them, and some of it is the tools that I use. If you innovate with the idea that you're going to make money, no, don't do it. Work out which, and again, I'm going to call out Paul Ferris, who taught me so much about this space. And Paul, if you're listening in, bless you, amazing man. Paul's approach was it should be guided, innovation should be guided by a need, right? It's identifying the need that is the first step. And in fact, I'll tell you, when I first met this guy, it was because I wanted help building a prototype of a lamp I'd developed to use in surgery. And I go in to see this guy, and he was at the time CEO of a design company. And he said, so why are you here? He's another Englishman, by the way, and this was in America, just outside of DC. And I said, why are you here? I said, well, I've developed this lamp because when I've been doing this operation, I sometimes have an illumination problem. So, I think, and he looked at the lamp and he said, I don't want to see that. He said, tell me about the problem. And I described the problem to him. And he said, have you ever thought that there's another possible interpretation of what you've just told me? I said, no, how do you mean? He said, maybe you're just not very good. In other words, and I'm sitting there, no one's talked to me like that before. Right? I'm a professor. And he's saying, so I've set aside my natural, as the eye arose in me, I set it aside and said, what do you mean? Because he was clearly a very different kind of personality. He said, maybe the problem you're having has got nothing to do with the problem someone else is having. But let's set that aside.
I really want to come back to that because that's really important.
Yeah, well, we will. But what he then said was even more insightful. He said, if it is a problem that other people are having, why do you assume that this product solves that problem? Maybe there's better ways to solve it. So it was inspired innovation. It's inspired by a need, and it's inspired by a very careful evaluation. Because I tell you something, in my field, if you give me a device to use in an operation and there's a right way to use it and 25 wrong ways, I guarantee you I'll get it wrong. I'll use it the wrong way around, I'll put it in upside down or whatever, because, if it hasn't come from our training and it's not imbued in us, and you want to remove that opportunity for error. I call it NPD-PIP. It needs to be nurse-proof, doctor-proof, idiot-proof. But blessings to Paul, because he really taught me a lot about innovation.
So you've just delivered a lot there. There's a lot to unpack, because the first place I want to go to is, that statement you said about somebody walks into a room who's never met you, has to trust you enough to take off all their clothes, and later on has to trust you enough to be completely naked on a metal table surrounded by strangers with knives. And I want to just shift that away for a moment from medical and go, hold on a second, how is that a metaphor for what we do in leadership? Like, these people have to walk into your office and trust you with their absolute vulnerability of, this shit's not working, boss. And know that you can come at them with the knives and cut them apart and throw them out, into the trash as an employee. They've got to trust you that much that they're willing to do that, to bear themselves naked to your knife as the leader. So that was one really powerful point that I just instantly went to leadership.
I love it that you see a metaphor there. I've never thought of it like that, but you're absolutely right. And in fact, just today, I was with a friend who's a business leader, a founder, and he was telling me they've had a dodgy few months of this year, and his underlings had not informed the workforce that he didn't want to tell them that there was a hiring freeze.
Right.
And he said, why? He says, well, because it'll frighten them, it'll upset them. And he said, no, it'll make them own the problem and realize that we need to do things differently. I think it's not demanding people trust me. You have to earn that trust and that respect. Yeah, I didn't tell patients, you bloody well do what I tell you. No, I would explain to them in all honesty, the situation they're dealing with and how I think we should best deal with it. And if they didn't trust me or like me or care for me, they're free to walk out the door. And it's the same in a business.
Exactly.
Any business, I would imagine.
Well, and that's why what you said about that innovation is based on a need, and sometimes innovation is for innovation's sake, and sometimes people are incredibly innovative in that they see a problem before it exists. I.e., I can't truck around with 1,000 albums in my car, but I can own an iPod back in the day, according to Apple, and I can put 1,000 albums on that. That was a problem that we didn't know we had, that, Jobs was able to see. It was brilliant. However, there was a piece there that you said that I just thought was just a brilliant, brilliant piece for business leadership. And you said it was from this guy, Paul, which was, maybe the problem you have is yours. Maybe the problem is not a problem. Maybe it's your problem. Maybe you're not good enough. And I think that we have been egoically, we go, well, everybody has this problem. And that may be true, but to question that piece. So yeah, okay, maybe it's true that everybody in leadership or everybody in this industry, whatever the industry is dealing with this problem. But that step back, that humility of self-knowledge, which is, what if this is me? Maybe I'm just crap. Maybe I'm not good at this. A, gives us the humility to consider whether we need more training ourselves. B, it gives us a way to understand maybe I need another hire in an area that I've been doing because I just thought it was what I have to do. And moreover, it then becomes the precursor to innovation because I can find out, is it a universal problem? Is it ubiquitous? Or is it just me? And I like that right there, that's the gold. Like that is golden because it challenges the crap out of the ego where I or any of us wouldn't necessarily recognize our ego as has the reins. And that for me is fascinating.
Yeah, but again, it comes down to when I talk to people about the inspiration for their career from a medical perspective, because like you, I'm fascinated and I love your tagline, stay curious. I use that the whole time. And I credit to you. I took it from you. I love it. Stay curious because you use it or lose it, right? So working your brain is a good thing, improve quality of life for ourselves. And if you look at the origin stories about why we do what we do and how we're taught, when I was trained as a surgeon, we were trained in the concept of what we call tiger country. So if you're operating on an area of the body, let's say the porta hepatis, which is kind of where the gallbladder and the small bowel and the liver and the pancreas all comes together in this tiny little area, the porta hepatis. And when you're working down there, let's say you're doing a gallbladder operation, you go a few millimeters in the wrong direction and you are in tiger country, meaning there are things there that can bite you, but more importantly, can bite the patient. The patient can die.
Yes.
Right, if you make a wrong move. So we were always taught what's around the next corner. Is there a tiger? And I know I want to talk to you about the sympathetic nervous system, parasympathetic at some point, and the concept of tigers and the way I felt as a surgeon going into an operation. I am hyper aware, hyper focused. Turns out I was actually mindful. Didn't know it, but that's mindfulness. Really focused. When you fly airplanes, it's exactly the same thing, Dove. You're taught to fly ahead of the airplane and constantly asking yourself, what's the worst possible thing that could happen next? And having had, a couple of interesting experiences in aircraft, and I've been trained how to deal with them. So there's nothing magnificent about what transpired. It's training, and it's also the influence of people that you've worked with who you admired. And in my case, I could call them out by name, every single, starting with Sir Robert Shields, who was my first boss in Liverpool, and who was not only a darn good surgeon and a good doctor, but I was the lowest man on the totem pole, and he treated me with kindness and warmth and humor. And I wanted to please Bob Shields because he was my boss, and creating that environment. And I think good leaders, whether it's in medicine, aviation, business, the music business, anything, they all have the same characteristics. But I know you know much more about this than I do.
But that's again another interesting piece, this idea of tiger country, because I want to make sure that the distinction is clear. So tiger country, talk to us about the distinction between that and living in fear of what's around the corner, because those two things are very different. And that takes us into our discussion around the vagus nerve and the sympathetic system, et cetera. So, because it's very easy to live in a fear place and go, oh my God, terrible things could be around the corner.
Yeah, no, it's not like that, because if you've heard the expression, everyone's heard the expression, paralyzed with fear. You can't do surgery and be paralyzed with fear. Right. You are hyper acute, you're hyper aware, you're very, very focused. And in fact, like I mentioned mindfulness, and I think that's the distinction. I didn't know I knew about mindfulness until I was at a conference, and this brilliant female surgeon was doing a talk on mindfulness. And I was baffled why there was a talk on mindfulness at a colorectal conference. And she said, many of you are asking yourself, what's a surgeon? And I'm thinking, yeah, right up, lady. And she said, okay, close your eyes. I want you to think of the hardest possible operation that you do with any degree of routine. Now I want you to think about the hardest possible part of that one operation. And then she said, okay. And she waited 10 seconds. Open your eyes. How many of you were thinking of anything other than what I just told you? Not a hand went up. She said, that's mindfulness. So being aware that there's tiger country, you can navigate tiger country. You just have to do it where you have to have local knowledge. You have to know what will enrage a tiger. And if you see a tiger and it looks like it's, I used to see bears when I would go hiking in the Appalachians. And I considered seeing a black bear a huge privilege, massive privilege. I was always very cautious. If I saw one, I'm not going to approach him. I'm not going to do anything dopey, but I can experience the high of seeing something magnificent. And I considered operating on the human body as magnificent as it gets, not being frightened.
So again, let's make the distinction for those who are tuning in, because hyper-focused is not the same as hyper-vigilant. And so hypervigilance, which is a response of your amygdala, it's very much fear-driven, and you are in expectation and of something bad, and so everything is read through that filter. Everything is read through the filter of, oh, this is going to be bad, versus hyper-focus, which can actually be when you're in flow. You're hyper-focused, but naturally moving with whatever shows up. So that if you're aware I'm in, quote, tiger country, and that might be in a negotiation in a meeting, it might be in dealing with a strategy session, that you know that the feces can hit the fan at any single moment, but you have planned for and clear on that, and you're paying attention to it, but you're not running into it filled with the adrenaline or the cortisol or you'll have adrenaline, but not the level of cortisol that would come with the fear of going, oh my God, it's going to go terrible. And so it's a real clear distinction that people need to get between the hyper-focused, I'm aware, I know the things that are ahead of me, and I also know the things that could go wrong, versus I'm so fixated on things going wrong that I'm not actually focused at all. I'm actually lost. And as you said, paralyzed with fear, and that part of the system is shut down. We're coming to the end of part one of this episode. As we go into part two, we want to talk about some of the innovations that you've been part of. I want to talk about how you've been pioneering some of those things, particularly in the context of, as you said, as the sympathetic nervous system, the vagus nerve, and all those kinds of things. I'll explain what those are and why these are such important innovations, particularly for leaders and leadership, because you and I have done lots of work around that, and we're seeing these things coming forward. I want to bring that into play for the leaders who are watching. As we get into that, like I said, that's going to be in part two. As we finish up in part one of the show, I would love for you to share with our viewers, with our listeners, where they can find out more about you, Jonathan, and your resources and technologies, etc.
Well, that's very kind of you. You know me, and you know that my default response to that is going to be, I'm sure you've got better things to do. So listen, I like everyone today who's in a professional sphere. I have a profile on LinkedIn, Jonathan Sackier. I'm, as you pointed out, a keen aviator, and I combine aviation and health by being very privileged to write for the Aircraft Owners and Pilots Association, AOPA, Alpha Oscar Papa Alpha. And if you go to aopa.org and you put my name in, it'll come up with podcasts and webinars and fun facts and articles and videos that I've done over the years. Been doing it for about 15 years. And then I've also been doing podcasts and webinars on medical matters for a group called EMJ, and that's at emjreviews.com, and just go to resources and there's podcasts, and you won't see my ugly mug, but you'll see hundreds of podcasts there on medical matters. So
Fabulous.
if you're interested.
And there's lots there. And again, we will make sure that we do post all of those in the show notes so you'll be able to access those easily. Again, we are grateful to you, Jonathan, for being with us for this first part of this delicious conversation. We're going to be back in just one click. So for you, dear listener, stay curious, my friends. Stay curious about the different technologies, the different wisdom you have, the different knowledge you have, and how those things come together to create real innovation. We'll be back in just one click. Stay tuned.